I'm Courtney. I'll be your nurse for today. I'm going to wash my hands. I have washed my hands. Now what I'm going to do today is I'm going to perform a respiratory assessment, a heart and neck assessment, and also an abdominal and renal assessment. Now what I first want to do is I want to check the posterior chest area. And what I'm doing is I'm checking for a straight spinous process. One is present. Now what I want you to do is just raise your hands in the air. Thank you so much. I'm checking for the APT diameter, and it is elliptical in shape at a 1:2 ratio. Now you can lower your hands. Now what I'm going to do is just palpate your posterior chest, checking for any lumps or masses, any tenderness. Do you have any pain?
No, no pain.
There is no tenderness, no lumps or masses. Skin is warm to touch and moist. Now what I'm going to do is I'm going to assess your tactile firmness. And with tactile firmness, we check for vibrations via speech by having the patient say 99 every time that I move my hands across the posterior and anterior chest cavity.
99, 99, 99, 99, 99, 99.
And now what I'm going to do is check the anterior chest.
99, 99, 99, 99.
And spread your arms.
99, 99, 99, 99.
Thank you. And tactile firmness was present equally and bilaterally upon palpation. Now what I'm going to do is palpate for your chest expansion. And I'm going to ask you just to deep breathe. And what I'm doing is just making sure that my thumbs separate symmetrically. Symmetrical and equal with no abnormalities. Now what I'm going to do is percuss the posterior chest, looking for any resonant sound. Resonant sound was present upon percussion. Now what I'm going to do is auscultate for the breath sounds. Just deep breathe for me. And I'm just going back and forth making sure that it is equally bilaterally, since they do have two lungs, one on each side. Vesicular breath sounds heard bilaterally with no wheezes, rales, or rhonchi noted. Now what I'm going to do is inspect the anterior chest, that is the front. I'll turn this way, thank you. And what I'm going to do right here is I'm checking for respirations, and I will usually check for a full minute. Respirations are even and unlabored within normal limits at 18 beats per minute. Also, there was no excessive use of accessory muscles. Patient seems very relaxed. Now, what I'm going to do is percuss the anterior chest. Just kind of turn that way. And I'm percussing the lungs. And lung sounds were resonant upon percussion. Also, I'm going to auscultate for the breath sounds in the anterior chest. Again, doing it bilaterally. Breath sounds were vestibular, bilaterally with no wheezes, rhonchi, or rales noted. And that is the end of the respiratory assessment. Now what I have done is I've had the patient lie back in a supine position. I'm checking the abdominal area. I'm going to use my little pen light Checking for the contouring of the abdomen. The light helps with visibility. It is rounded. I'm going to come to the top to see if it's symmetrical. It is symmetric. And there are no lesions, striae, or any scars. Also, it is an expected color variation. Also, what I want to do now is I'm going to check to see that the umbilicus is located midline, which it is. And also I'm going to check to see that it is inverted, and it is. Now I'm going to check for parasallis or pulsations. Anterior pulsations are visible upon the abdominal area of the patient. Now what I'm going to do is I'm going to auscultate for the bowel sounds in all 4 quads. Checking the right upper quad, left upper quad, right lower quad, left lower quad. And it is normal active times 4 quads with no vascular scowls noted. Usually I would check it for a minute in each quad. If I don't hear it within a minute, I would check for 5, and after, if nothing is heard, I would notify a doctor. Now what I'm going to do is percuss each quadrant. Checking for any tympany. No tympany times 4 quads. And now I'm just going to have you sit back up, please, and thank you. And what I'm going to do is I'm just checking for her CVA tenderness. Any pain?
No, no pain.
Any pain?
No.
Okay, I'm going to have you lie back down. Negative CVA tenderness. And now what I'm going to do is palpate, do a light and deep palpation. And just let me know if you have any pain. Any pain?
No, no pain.
And any pain?
No.
There was no pain or abnormalities. Now what I'm going to do is check for the liver. And that is usually found in the right upper quadrant and left upper quadrant. Let's take a deep breath for me. Any pain?
Mm-hmm.
And the liver was palpable with no abnormalities. Now what I want to do is check for the spleen. And that is usually found in the left upper quad. Take a deep breath for me. Any pain?
No pain.
Spleen is palpable with no abnormalities. Now what I want to do is check the liver. The kidneys, I mean. Any pain?
No, no pain.
Deep breath. Any pain?
No.
Kidneys are palpable bilaterally with no abnormalities. Now what I want to do is check your aorta. That is usually, we find the midline of the abdominal region, and it's usually on the left side, just in the left upper quadrant, just on the left side of the midline. Any pain?
No.
Anterior pulsations noted. Now what we're going to do is I'm going to check for the Murphy sign. And this usually indicates gallbladder or liver inflammation. And it's usually found in the right upper quad and the left upper quad. Deep breathe for me. Any pain?
No, no pain.
Deep breathe for me. Any pain?
No.
Negative Murphy sign with no pain. Now what I'm going to do is check for her rebound tenderness, and this usually indicates peritoneal irritation. Any pain?
No.
Okay. And now what I'm going to do is check her Rosing sign for referred pain, and this usually can indicate a acute appendicitis. So we're going to check the left lower quad. Deep breathe for me. Any pain?
No, no pain.
Negative with no pain. And now what we're going to do is check for the iliopsoas muscle, which can usually indicate acute appendicitis. Deep breathe for me. Any pain?
No, no pain.
Negative iliopsoas muscle test with no pain, and that completes my abdominal and renal assessment. Now what I'm going to do is I'm going to start the heart and neck vessel assessment. I'm going to palpate your carotid arteries. Never want to palpate both at the same time. There's a normal strength of 2+ with an upstroke smooth and strong bilaterally. Now what I want to do is I'm going to auscultate with the bell. And I just want you to inhale, exhale deep, and hold your breath. Inhale, exhale, hold your breath. Inhale, exhale, hold your breath. There were no abnormal signs or fluid present. Now what I want to do is, with you sitting up, I want to auscultate the areas of the heart. What I do is the sternum, and I want to go right above the sternum, right below the clavicle line, and I want to find the angle of Louis. And just to the right, within the second intercostal space, is the aortic area of the heart. Just to the left is the pulmonic. Come down to the third intercostal, and that's the Erb's point. Then we go down to the fourth intercostal, that's the tricuspid area. Then we go down to the fifth, just lift up for me, right at the apex of the heart, and that is the mitral area. And now what we want to do is, I want you to lie down for me, please. And I'm going to have you turn your head just to your left. And what I want to do is, I want to check the jugular vein distension. Pulsations are noted, and it is non-bulging. And now what I want to do is check the pericardium, the area that lies right over the heart. And there is normal respiratory activity. And now what I want to do is palpate while she is laying down, palpate the areas of the heart again, finding the angle of Louis, aortic area. Then I want to come to the pulmonic, Erb's point, tricuspid, and mitral just at the apex. Pulsations are noted with no abnormalities. And now I just want to auscultate. Aortic area, pulmonic area, Erb's point, tricuspid, and mitral. S1 and S2 are heard with no extra heart sounds or murmurs. And that is the end of that assessment. Now for my documentation, patient did have a straight spinous process. APT was elliptical in shape with a 1 to 2 diameter. The posterior chest was non-tender, present tactile firmitus equally and bilaterally upon percussion, upon palpation. Also, it was symmetrically upon the symmetric expansion. Also, there was resonance sounds within the lung fields. Vesicular breath sounds bilaterally, no wheezes, bronchi, rails noted. Respirations was even and unlabored. Patient seems to be in a relaxed state, and it was in the normal limits of 18 beats per minute. Also, there was no excessive use of accessory muscles. And vesicular breath sounds equally and bilaterally. Also, for the abdominal and renal assessment, the chest, the abdomen was rounded, symmetrical, no lesions, scars, striae, and it was the expected color variation. Umbilicus, midline, inverted. Also, pulsations were noted. Normal active bowel sounds ×4 quads. No vascular sounds heard. No noted abnormalities with any palpations. Also, all the signs, Murphy's, Plumbar, Rosings, and iliopsoas muscle test, there was negative signs of that and no pain. Also, for the heart and neck assessment, patient had a normal strength of 2+ for the carotid arteries, upstroke, strength and strong bilaterally, no abnormal sounds or presence of fluid. S1 and S2 was heard in all the areas of the heart with no extra heart sounds or murmurs. And that completes my documentation.